Hi everyone, welcome to Rhoda 360. It's your girl Rhoda Winner, still riding solo. Very soon I'll be inviting people to this podcast. Today's episode is for every healthcare professional who has ever asked, where do I fit in clinical research? What happens when I decide to go into research from clinical practice? So whether you are a doctor, you're a pharmacist, a nurse, lab scientist, or other allied health professional, there's a niche for you, and it might not be in the lab. It's not everything that it's in clinical practice, right? Today, we'll explore how to identify your strengths, align them, carve out meaningful path in clinical research, and especially non-lab-based roles. So I want to begin by asking, what does niche mean in clinical research context or even in research context in general? What are the examples of non-lab based niches that you know? If you know anyone, or if you are someone who has been in clinical practice and now in a niche in clinical research, please comment down or just send a message so that people can know. A niche is a focused area of interest and values that intersect with a specific need in the research ecosystem. It gives you clarity, direction, and impact. Non-lab-based niches include clinical trial coordination or even affairs, regulatory affairs, health education, implementation science, patient advocacy, data management, community-based participatory research. Now, think of your niche as your research fingerprint, which is unique to you. That thing that excites you, that thing that gives you the light bulb moment in when you're speaking. It's not about what you do. It's about how you do it and why you do it. So, what are those roles that are available for different health professionals? I want to dig into maybe doctors and pharmacists and nurses. Now, how can your background shape your research path? Now, we've been lucky to study all these courses and have all these good professional backgrounds, but how can this help us in other roles aside clinical practice? First, being a principal investigator and clinical trial leader. This is where you study things about translational research, health equity, digital health, which is now very interesting. Oh, there's money there, and there's a lot to be done in digital health right now. You're a pharmacist, you're talking about pharmacovigilance, medication adherence studies. You're studying courses like health outcomes research, prescribing, and pharmacoeconomics. For nurses, you're looking at roles like clinical trial nursing, patient-centered research, and you're studying courses or programs like care delivery models, chronic disease management, health literacy, and the likes. So for lab sciences, you're looking at quality assurance, you're looking at regulatory control, monitoring, data analysis, research ethics. Then you're studying programs that involve diagnostic investigation or innovation, bioinformatics, regulatory compliance. Now, these and even other health professionals can look at community health research, intervention design, studying courses or programs that involves rehabilitation, nutrition, mental health, fall prevention, aged care. And your profession gives you a lens, which we thank God for. It's a way of seeing things, way of seeing problems and their solutions. That lens is your superpower in research. Now, how can you identify your strength and your interest in the niches that you may come across? The question you ask yourself is, what energizes you? What problems do you really feel like solving? What skills do you enjoy using? So in doing this, it might not be okay to just do everything in your brain. You can journal. Asking questions like, where do I feel most engaged at work or in discussions? What kind of impact, right, do I want to make? Then you begin to talk to researchers in different niches. You can reach researchers through LinkedIn or other social media pages, even ResearchGate. Some would actually respond. Then you can go online, you could begin to take personality tests like the Clinton stress, the VIA character strengths. You know, your niche isn't something you find overnight. It's something you uncover layer by layer by paying attention to what lights you up, like what's that thing that excites you, what that thing you want to discuss. Now, you begin to ask and you begin to search, right? You begin to become a researcher even before you start. Who is that person, or who is that person that has gone ahead of you? What can you learn from their journeys? For instance, I know of a particular nurse who transitioned from clinical practice, normal nursing work, to patient-centered outcomes research. She had worked in oncology, yeah. She had worked in even physiology in the, in a hospital, right? Where, like in a medical school, she had worked there, but it was more of clinical research and the rest. Today, she's doing her PhD, and then she's working on transitioning into patient-centered research, creating frameworks, you know, and pathways that will help the population she's studying, that will improve their outcomes. She's looking at culture. She's looking at the intersection between clinical practice, culture, you know, things like that, socio-economic involvement. I also know of a pharmacist who is close to me, who is actually my supervisor, who now leads a deep prescribing studies in aged care. This person had been a pharmacist, registered pharmacist for a long time, and decided to go, you know, for further studies, master's, PhD, and then now he's in academics, and he's leading a big, like massive campaign, fully funded, well-funded campaign. Yeah, here. And it's something I really respect, that people will move out of their comfort zone. Because sometimes when we come out of school, the only thing we know is clinical practice. As pharmacists, sometimes the only thing we know is the prescribing and how to check for drug interactions before dispensing, and you know, all those pharmaceutical care, which is very important. If you think that is your niche, if you think that is where you are called, if you think that is your purpose, it's very, very important. I mean, without people like you, without clinical pharmacists, the world would have been another thing. Without people practicing nursing care or medical care, I don't know what would have been happening. But then it's not everyone that is made to be in that space. Some of us should be in research. Some of us should look at research and development. It doesn't matter what you study, right? Like we said before, our profession has given us a lens to see problems and create solutions to them. If you get stuck, or if you allow yourself get stuck in one profession or in one role, you may not be able to solve problems, even when you see, you know, those problems in other roles, right? Like in other positions. For instance, if you're stuck in clinical practice as a pharmacist, you may not really be able to solve problems in regulatory affairs. Now, these are the days of AI. And then we are having conversations and discussions about regulating AI in health, about prescribing or prescribing AI, about, you know, how AI is taking over a lot of things. If you are not in the right space in digital health, how would your impact be? What will it be? What will your impact be? Actually, talking? Sometimes talking is not enough. You need to be there Even if you talk, you need to be there. You need to be seen. If you need to be in regulatory affairs and you're stuck in clinical practice, I'm telling you, you may not find fulfillment. And it's not, at least I've come to now recognize that it's not about money in these professional roles. It's about impact. It's about purpose, right? So, yeah, there are so many other examples. Yeah, I also know a professor who I even met, I spoke with yesterday, and she's almost retired. She started from the United States, went to medical school, graduated, practiced medicine for a while. But she said while she was practicing medicine, it wasn't as if she knew that was not what she wanted. She wanted more. She wanted to study. She wanted to see how what she's studying and what she's putting to paper will make impact to people. She was tired of, reading all these books. In their days they actually studied books. It's not like now that everything is on the internet or or some software. No, those days they actually studied. They're doing all this. She didn't want to be, under that autonomy of clinical practice. She wanted out. And then she began studying again. She went for her master's and then her PhD in the same school. And somehow she started getting funding, right? Of course, if you're doing well, not as if due respect to every professional out there, but if you're really, really, really doing well, you know what you're doing, getting funding as a full-time researcher shouldn't be a problem for you, especially if you live in the West or the Big Fives or somewhere big countries like we have in Europe or UK or America or Australia, places like that, right? So I think it's actually researchers from lower and middle income countries that suffer. And I feel pity anyways for some of us that are from there. So yeah, and then she kept moving on. Today she's a full-time professor with over 300 publications, leading research groups that are making world global impact. Right? Imagine if she had said, okay, because I'm a medical doctor, I'm going to be stuck in some hospital. Yeah, she would have grown, but then she wouldn't have be that fulfilled. When she was speaking to us yesterday, like you could see the excitement when she said she has few years to go in her role and she's looking at retiring. Imagine she wants to put out some grant application, but she doesn't want to put out anything that will affect her retirement. Imagine somebody fulfilling purpose and being rested and well impacted to that point where she doesn't want any grant, right? Any funding to disturb her retirement process. So she's going to give out that grant application to maybe other people to put out. You could see the joy in her face. You could see the relaxation, and she was happy. She was able to do all that while being married, while having kids, while having family issues, while relocating from country to country. She had to relocate from the US to New Zealand, to Australia, to the UK, back to the US, and back to New Zealand again. In all this, it's not as if it was rosy for her, but then she did it. It's never rosy. Transitioning from role to role is never easy, especially if it's something you've not done before. Now, these stories remind us that your niche doesn't have to be traditional, right? It doesn't have to be what we studied in school. It could even be in banking. Yep. It could be in supply chain. Yeah. It could even be as a chef. It just has to be the true you. It has to be true to you. Now, while wrapping up today, A niche is where your passion meets purpose. That's truth. Your passion meets purpose. Your profession gives you unique lens to see problems and try to solve them. Now use reflection, mentorship, and exploration to find your fit, what actually fits you. If today's episode sparked something in you, I'd love to hear about it. I'd love to share. Please share your thoughts on my Instagram page, Rhoda360pod, or send me a message in the comment section below, or I'll leave my email somewhere. And remember, it's 360 degrees of inspiration and impact. Your niche is your power. So go carry it. See ya.